ASIS. Do not palpate on top, but find the most pointy area, come down, and then push up. And you're going to be much more consistent. All right, then when I do that, I get an idea, okay, how does that look? Now, it's hard to see in supine because you're trying to come around. So we're going to have you stand up on this and face that direction towards your classmates. All right. So I'm doing this in this position so you can see I would normally have her on the ground. All right. So I can hold you just like, oh, you have something right there. Okay. So I put my thumbs. Now, if you put your thumbs up and you have to go, there's nothing wrong with it. But if you go, whoa, there's something wrong. Okay? So I am finding the ASIS, go underneath and push up, and then I compare. It looks fairly even.
Yeah.
Yeah, looks fairly even. All right? Iliac Crest, I can do the same thing. With the iliac crest, I find that little indentation, push in there, and then pull down. And I do the same thing, and I compare. Does one look higher than the other? Good? All right, now maybe lay back down. And then Iliopsoas is a common muscle that spasms, that's tight, and that can cause or give rise to pain. Good? So I am going to palpate as my bony landmark the ASIS, and then I know what comes straight off the ASIS. Sartorius. Then if I go just past that sartorius and push deep, what's next? Say it. Rectus femoris. It's deep because it's not ASIS, it's AIIS. And then there's a large flat one, as long as I'm below the inguinal ligament, a large flat one that I'll palpate. I can't feel that it's muscle a lot of times when I just palpate it. So I want to put it in its relaxed position because it's stretched out. It's a hip flexor, she's in hip extension. So I'm going to move her into what we call the hook line position, and that puts the iliopsoas on slack. So I find my ASIS, I know it's below that. I say, what I'd like you to do is when I say lift your leg, do that, and back down, and then up and back down, okay? All right, I find my, go ahead and lift up and relax. Lift up and relax. I find my sartorius. And then don't panic, remember from last quarter, don't panic if you can't palpate the rectus femoris because it is a little deep. I say, is it a hip flexor? Yeah. I know it's not sartorius because I just palpated sartorius and I went medial. So I say lift up. Oh, I can feel it on you. Good. And then I know but if you don't feel it, no big deal. You're going to go about 2 fingers medial. So I go about, yeah, that's about 2 fingers medial. I go on the inside of that and I say, all right, lift up. Do you feel that big flat one right there? Good. Are you ticklish? Okay. Lift up. And then I compare 3 contractions. Good? Is this a manual muscle test? No, it is not. I'm not doing against gravity, although I am, but I'm not trying to grade it. I'm just trying to see, is that there so I can feel it? Is it working? And then once I feel it, I poke into it and say, is that your tender area? Is that tender? And if she said, oh yeah, that's the spot. Now a lot of patients will say, yes, that's tender. Is it tender if I poke it on it? Yeah, a little bit. And it depends on how wham you are. You know, like break a finger on, oh, I'll cry. And some people, you chop off their arm, they go, oh, it's a flesh wound, you know. So you want to kind of get an idea, is that the pain you came in with? Is that what's been bothering you? And then last but not least, you can compare to the other side. Good? All right, so once I've found it, there's the iliopsoas. That's a common one involved with back problems. Because remember, it attaches to the lumbar spine. Good? It affects the lumbar spine, the pelvis, and the hip. So that's a common one. So those are the 3 things on the anterior side. ASIS, we're just looking for levelness of the ASIS, levelness for the iliac crest, and and then we're palpating the psoas major. Okay, give those a try.